Hey guys, Don here. Welcome to Podiatry Practice Mastery, and where I kind of go over the things that help you get your practice to the $1 million mark and beyond. So I want to share something that was kind of eye-opening today. So we're going on a year with our new associate. So we had a previous kind of associate, and now we have a new associate. And I always like to talk about the good, bad, and the ugly. So recently, the ugly has been switching medical records, which has been kind of a hard ordeal. We're at about week 4, so it's finally starting to get better. So recently I was meeting with a friend of mine named Sean. So Sean is a marketing guy. He kind of helps with like Swift marketing and things like that. And we were looking at some things of like, okay, how can we do better in our practice? And one of the things we were looking at was, well, we have this young doctor, and we wanted to get him busier. So we have dabbled around with trying to get him busier and trying to get him more profitable. So the two main issues we found, and the one was really kind of blatant, is we want to have him produce more revenue. So if we look at revenue production per patient, so usually myself and my partners are about 150 to 160, 180 per patient value. He is in about 1 to 120. So there's about a $60, $50 to $60 difference per visit. And so that's just a matter of like training and like knowing how to be efficient and knowing how to work up patients and being comprehensive and things like that. So maybe adding on an ultrasound or making sure you're getting x-rays for each patient, making sure you're offering orthotics and things like that. So that is trainable. And what we've decided is each doctor, we're going to block our schedule 1 day a week. So myself and one of my other partners, we're going to block our schedule and just kind of go over like a training schedule. We put it into AI. We had them make a training schedule, what we're going to go over, and kind of talk about how to be most efficient. Like he's going to present like how he, let's say, treated plantar fasciitis, and we're going to ask why he didn't do certain or other things to help get that number up. So that's one thing. That doesn't feel as painful. What really felt painful was when we looked at the monthly numbers, because we produce our monthly numbers each month. And if you want to see mine, just let me know. Shoot me an email, don@podiatrypracticemastery.com. I'll send you mine. It's basically a big Excel spreadsheet. And it shows that, like, as doctors, each month we're producing, as the doctor owners type of thing, we're producing anywhere between 100 to 90 to 80. It's been a little bit lower because the medical record transitioned like to 60. But usually the 80 is the marker that I say. So if you keep it at 80 as an average, you're going to get to the $1 million mark. And so he is producing at about 30. And so let's say between 80 and 30, okay, is about, 50,000 delta. And so where I was really feeling bad is I'm like, this is going on for about a year, and it used to be a bigger delta. The delta used to be 60 or 70,000. Now it's only at 50. And so the thought is, how much are we willing to pay for speed, and how bad does this hurt us? And as a practice, like, we're all just so busy treating patients. When we have these new doctors in, we have a hard time getting them up to speed, both getting them busy and also being more productive in their treatment options. So usually what we do, is you're hoping they'll just kind of catch on and be able to produce effectively and produce at a higher amount and get busy. And so there's a couple of options we kind of thought about. One is like setting time aside to train, both training how to treat patients. Like, he already knows how to treat patients, but how to be profitable with treating patients, going over different conditions, but then going over like a networking plan and giving him time to do that. And that might even be like a half day of the week, going out and visiting primary cares, finding different places to go visit, say hi. And this needs to be done in the beginning. It's much better to do it in the beginning than later on, but without a plan, nothing gets done. And then the other thought would be, well, would we just pay someone to set up these things for him? Because part of the challenge I find is actually getting on the phone and setting up the meet and greets with the primary care, or the lunch and learns with them, or other types of institutions. And so one way of doing that is paying a third party, like virtual assistant, almost like a virtual practice rep, which was kind of my idea. If you could have a virtual practice rep set these things up and spend, say, time for this. And what it comes down to, which Sean was telling me about, he says, Don, so if your delta is 60, let's say 50,000, how much are you willing to pay to bring him up to speed and produce 50,000 more per month? Like, I'm thinking, okay, we switched medical records, okay, as an idea. We switched medical records because we feel like with ModMed we're going to save $70,000 a year. So we're going to save $70,000 every single year. That's a big number. But if you think about it, and we didn't think about it this way until now, like if we think we're losing $50,000 every single month, that's like at the end of the year, that's $600,000 we're losing as an office. For certainly he takes his percentage and things like that as an associate, but he's not that busy. So either you pay to get them busy with like AdWords and marketing or advertising, or you kind of train and have them go out and do things, or you have someone else set these things up. So the thought would be, could you take that, let's say 10% of that, like a $5,000, and make that as a marketing budget? So whether you pay a virtual assistant, whether you go out and take time off to do this stuff, like just put a budget in of like 10% of that, and then go to town on investing that in this new doctor. Because I think at the end, investing the $5,000 a month, at the end of the year, $60,000, investing that. But if that returns at $600,000, that's more than worth it. Okay, it's something that we're kind of new working on it. So if you guys are already doing this, like let me know how you do that and how it's working for you. But I would love to know how you are doing this. You're probably ahead of us, but I would like to know, because we don't hire a lot of new doctors, so we don't always do this. So it's not in our wheelhouse. I think maybe if you're a bigger practice and you're always doing this, like one of these big franchise ones, you would know how to do this better than we do, but we're just kind of figuring it out. So I've thought about, you could even hire some people that I really respect, like Chris Milkey or Peter Wishney, and they could actually train the doctor, and they may even train them for that $5,000 a month mark, right? So they would train them and have them do things and keep them accountable, so we wouldn't have to. So that would be another option, is kind of outsourcing it. Anyway, I just want to share, I always like to share the good and the bad and the ugly, and this is one of the ugly things that we found that we are doing incorrectly that hopefully we can improve over time. Okay, hope this benefits you. If you have any thoughts, shoot me an email, don@podiatrypracticemastery.com. Once again, if you also want my newsletter, go to the website and download anything that I have there, and you'll get my newsletter that comes out once a week. Okay, thanks.